Hey there, it's Dr. Cammisa. Welcome back to our video series. And today we're talking about Prp A2M, a super concentrated PRP formula. I'll explain how that works. But if you're new to our channel, hit the subscribe button, turn on your notifications. But stay tuned, I got lots to share. So today I want to talk about one of the types of PRP that we do, which is the Prp A2M. And A2M stands for alpha 2, the number 2, macroglobulin. It's a protein that inhibits a certain enzyme that destroys cartilage. So when there's a pro-inflammatory reaction, your knee is swollen, you've got an old injury, a chronic injury, these enzymes break down the cartilage. So one of the PRP solutions we have is taking blood and concentrating it. If we were to take, so this is a 60 cc syringe. So if we were to do 2 syringes in a container, and the container is one of these containers that we use for our processing from Emcyte Corporation. And so when we do the first spin, we have all the whole blood in here. And then after the first spin, we have plasma on the top, red blood cells on the bottom, and the green here is the growth factors. That's where all the platelets are, all the healing cells. So then we discard the red blood cells and we spin it another time. So we take the plasma and the growth factors, spin it one more time so it's really purified and concentrated. And let's just say that this blue syringe here, which is 60 cc's of solution. It's actually Gatorade, but we'll call it plasma for today. So we take this, and now to make the A2M, 90% of this is water. And so through the process of a special filter that we use, the plasma is pushed through this filter back and forth, and you're going to see this live today. Push the filter back and forth, and then we have another syringe that has created a vacuum, and that vacuum sucks the water out. And so we go from a situation where we have this much plasma to a concentrated plasma, and this would be a constitution of a A2M amount of plasma. We would mix this then with the platelets, and that would be a PRP A2M. So we get a super concentrated injection to help stop the inflammatory enzymes from breaking down the cartilage, and then the PRP, where all the growth factors to start the regenerative of that joint. That's where we get the best results, is when we combined, take the excess water out of the plasma, concentrate it, and it creates a very powerful anti-inflammatory regenerative injection. Hey there, it's Dr. Cammisa. Welcome back. Today we're still talking about our PRP A2M. So I just drew this from a patient. So we have 2 tubes, about 120 cc's of blood. So now we're going to be going through the process with Emcyte system. And so we're going to put each tube into one of these double chamber, double spin containers. We're just going to alcohol swab the top first. Flip that over, do a little swab. And so this is a closed system. So we just release the product into the container nice and slowly. So this is chamber 1 that is filling up. Okay, and we're going to do the same thing with the second tube. Then we're going to weigh them and put them in a centrifuge. We'll see what these weigh. Give them another final wipe. And on the scale, we have 116.2 and 117.2. So we're within the 3 gram mark. So these are going to go in the centrifuge here. 3,800 RPMs, for 2.5 minutes. Stay tuned for part 2. Okay, so we just finished our first spin. And so you see here the plasma's on the top. Red blood cells are on the bottom, and that layer between the two is where all the growth factors and platelets are. So I'm going to pull up on the first one here. I'm going to pull up, and you're going to see the plasma coming into the syringe. So this is all plasma, and we're looking for a red flash to come in right there. That flash, that's all the growth factors. So we're going to take that, we're going to put it into the second chamber. Remember, this is a 2-chamber double spin system. So here's the first one done. We put the cap on to secure that product in the bottom chamber. And now we're going to do the same thing with this one. So again, we're going to capture the plasma first. We're looking for that red flash right there. That's it. Oh, we're going to put that in here. We're going to apply that product into the bottom chamber. Okay, we're going to put the cap on. We're going to spin these again, this time for 7 minutes. Stay tuned for part 3. So now what we're going to do is, you can see all the plasma in the bottom here. We're going to extract the plasma into another syringe here. And you see the plasma being transferred. I'm going to leave a little bit of plasma in the tube so we can mix the PRP just a little bit. Probably just like that. And we're going to do this one more time. So now what's left in both of these containers is that's all the growth factors and a little bit of plasma. So I'm going to mix this around, and then this is all the plasma left in here. So we have literally about, out of a, 50, an easy 50 cc's of plasma. Okay, so now I'm going to just agitate the rest of the platelets with a little bit of plasma. And the same thing, I'm going to extract this now. Okay. We'll come back and clean that one up. And now we'll do the same thing with this one. The platelets are sticky, so they need to be agitated to come off the bottom. So you see we have a little bit more in one than the other, so I'll clean that up in a second. So now that was step 3. We did the first spin, the second spin, and now we're going to do the plasma, which will be step 4. So as you can see here, we got both of the containers fairly clean. We took out all the platelets, and now we're in the process of we're going to concentrate the 50 cc's of plasma. So what you're looking at here, this is the dehydration or plasma concentrating tube. So we have just an air adapter here. This is the 50 cc's of plasma. We're going to go into this side. And this will become this tube here on this side will become the vacuum tube for the water. And once I fill the tube up, so the plasma's coming all the way through over to this side, so it's already there, I'm going to take this tube off, put another syringe. So now we have a 3-syringe system. This is going to be the vacuum that's going to collect the water. We started with 50 cc's, and what we're going to do now is pass the plasma back and forth through the tube. So you can see here, we started with 50. We're maybe at 17 now. And if you take a look, you can see the water that's inside the syringe here on this side. We're going to keep going. That's pretty good. So as you can see here, we're at 10 cc's. We started with 50. So we evaporated 40 cc's of water. 80% of the water is gone in this particular case. And so now we're going to take this 10 and divide it into the 2 PRPs. So we're going to end up with a concentration of anywhere between 10 and maybe 14 times baseline plus an A2M concentrate. So we'll go to, now I'm going to make the syringes and show you the final product. It's like a thick, like maybe maple syrup. You know, maybe it kind of looks like maple syrup, I don't know. Anyway, so now we're going to mix this with the PRP. So now we have ready 2 PRP A2M syringes. This is what differentiates us from other clinics that do PRP, because an automated system cannot make this PRP. It has to be done by hand. It has to be done in a double chamber system, in a double spin. You have to be able to dehydrate it with a system that looks like this. Look at all that water in there. So this is how we make A2M to help stop the degeneration of cartilage in a knee or a hip, a shoulder, wherever it may be.
Okay. And I'm going to do an injection of the labrum. The first about is let's localize the labrum. And the labrum is right there. You see a round part on the right side of the screen, which is the humerus. On the right side is the head of the humerus. On the left side of the screen, let me actually do it like that so you can see as it actually is. You can see the humerus right here, the round part. And then you can see a little triangle in the center, which is what the labrum is. And now you're going to see a needle you're going to see a little dot that looks like a falling star. At a count of 3, 1, 2, 3, you can see it through the center. You see the falling star right there, right there, right there, right there, right there, until it gets to the labrum. There you go. And you see a little bit of flow, of white flow there right at the very bottom. You're going to be feeling a little bit of pressure in that area as I'm actually injecting the product into the labrum. You're going to feel some pressure inside the shoulder, right? 5, 4, 3, 2, 1, coming out. There you go.